Your favorite painting?
It's the one of Lady Jane Grey. Like,
Oh, I've seen that.
yeah,
Where she's going to be executed?
yes, and
Yeah, that's
everyone's
real
just like,
intense.
it's so intense. Every time I
Yeah.
look at it, I start crying.
That's at,
Yeah, it's in London.
yeah, it is in London. Uh-huh.
You've been?
Hmm.
The one in London?
Yeah.
Nice.
And I've seen that painting. First of all, it's huge. And second of all, it kind of is shocking to see because she's blindfolded and she's this very young girl. She's probably maybe a teenager.
Yeah.
And she's itty bitty. And there are these guys that are basically hanging around, kind of bored to death. There's a guy that's kind of getting her ready to be executed. And there's a guy that's sitting there with the chopper, ready
Yeah.
to do the chopping. He looks like he's bored to death. Like this is like the 10th one of the day, and I'm bored. Can we go to lunch, or can we go for a drink?
Isn't that insane? Like, they're just
And then
all
there are the women
executed.
that are there as witnesses, and they're like facing the wall and like crying, and
Yeah.
it's
It's
an intense.
emotional.
Yeah, it's very intense. So we are here talking about art, and which we both love. But we're also here talking about sexual health and things that patients come to you and to me
Yeah.
to improve their sexual health. And through that improvement, they live better and more fulfilling lives. So I wanted to introduce you. You're Summer.
Yes.
You're one of the nurse injectors at ACPS, and you've been. Yeah, well, tell us your story. Tell us your background and how you came to ACPS. Is it working?
Well, I'm one of the registered nurses here and finished nursing school, did surgical oncology, did dermatology, and then went into Mohs surgery where I kind of was a scrub nurse, which I feel like really has helped me with injections and anatomy too. And then decided that I just really needed to become an injector. So got into this realm, but I got really interested in sexual health for men and women and the treatments that we can do for that. So I kind of felt like I went back to my old, like, I feel like at my old jobs, you know, you have to do a lot of work down in that area that everyone's so scared to touch in this industry, I feel like. So
Down under.
down under. And I was like, I'm not scared.
Not Australia.
Like, it doesn't bother me at all. That's what, in the oncology unit, everyone needed some help down
Right.
there one way or another. So I felt like I got to go back to that and help people with their sexual health. So it's great. I love it.
So you started off in oncology, did Mohs surgery, and worked literally helping people getting through really intensive medical treatments.
Yeah.
And you shifted along the way to aesthetics and never looked back.
No.
So how long have you been with ACPS?
I've been here for 2.5 years now.
Gosh, it seems like I've known you for longer than 2.5 years.
Right?
But I guess it's just been 2.5 years.
Do you remember you did my interview?
I guess I did. But it feels like I've known you for much longer
I know. Yeah.
because we work pretty closely together and we see each other often. I'm usually on this side of the building, and you're
Yeah.
on the other side in the spa.
Yep.
And so, our paths cross often, but you do non-surgical treatments and I do surgery. That's my area of expertise.
Yeah.
So when patients come to you for improvement in their sexual health, what are the procedures that you may offer them? And I know that women tend to outnumber men by a wide margin, both in your practice and mine.
Yeah.
So let's talk about the gals first. When they come in, what are the things that you offer or can offer them, and the things that you have found are very effective in their health, in their sexual health?
Well, the big thing right now is the labia puff filler, which is a funny name, but if someone feels like they have laxity in their labia majora, or Ozempic patients, they're losing weight, So you lose weight if we have fat in a layer of the labia majora, and that's an area where you can lose volume. So if we inject the labia majora with some filler, sometimes it actually, even though you're filling it, you're making it bigger, it actually looks smaller because you're kind of balancing that look and you're giving it the volume that it lacks. So it looks good.
It's named appropriately the puff procedure
Yeah.
because, when patients either get older or not necessarily get older, but maybe lose weight or have women have children, the anatomy can change.
Yep.
And they can lose volume in the outer lips, the labia majora, not the minora. There are other procedures that are done for the minora. But the outer lips or the majora can deflate and look older. And so the patients come to you to restore the volume there and feel better and look better. And so that's done with filler. Hyaluronic acid filler. Tell us a little bit about the hyaluronic acid fillers. That's not a word that is common or people hear about commonly. They sometimes may hear Restylane, Juvederm, those terms. But those are a kind of filler that we've been using now for several years.
Long time.
Do people need to be tested to receive them, or people can just come in off the street and be ready to get the treatment done?
They can just come off the street. No one's really allergic to hyaluronic acid because it's a naturally occurring thing in our body. This is just it's a synthesized version of it that we can inject. And I have never seen anyone have a problem with it, actually.
It used to be years ago that back in the day when collagen was being used for filler.
Wow.
And now it's rarely, if ever, used.
Yeah.
People would come in for a skin test, but those days are way back in the past. And now, with these newer generation of fillers, and hyaluronic acid fillers are really the most popular ones, they can come in and it feels pretty safe and confident that they're going to have a good treatment and they're not going to have an adverse reaction from having the filler, and they're going to feel better. How long typically do these fillers last for the puff procedure?
It does depend on the body. We know that some people metabolize the filler a little bit quicker than others, but we can usually say safely about 8 to 12 months, depending on the person. And then just a little side note, there are some patients out there who don't want to get hyaluronic filler, acid filler. So we'll do Sculptra because is a biostimulatory medication that we use to stimulate collagen. It might not be as plumping as the hyaluronic acid filler, but it does do a good job of helping with that. And then if someone wants something even more natural, then I can do their own plasma in the labia majora. And
so they have different options.
Yeah, there's always so many options. That's the great thing about this industry.
And they can last, several months, depending upon the treatment that's done.
Yeah.
One of the things that I do that can sort of do the same thing, but maybe a little bit longer lasting for the ones that sort of want to test it out, test the waters and see how it goes and how they like it, is using their own fat.
Yeah.
Well, so fat grafting of the labia majora is another treatment that I offer. That's a surgical treatment, and sometimes can be even done in an office setting under local anesthesia.
And if I was a woman who, if you're doing a mommy makeover and I was already getting things done, I would tell you to just go ahead and put my fat in my labia because you're already under, and it's just so much easier. So you might as well. Don't waste the fat.
No, not rarely. These days, often patients come in not only to have the fat removed from the parts that where they don't want the fat, but we can use the fat where they do like to see a little bit more plumping. The breast is now becoming a very popular area of the body to augment with fat, with natural fat. The buttock, BBLs have been around now for a decade or two, so that is still going strong.
Yeah,
and
because they can look so natural.
Right, exactly. And now the labia majora is yet another area where fat grafting can be done to restore the health and appearance of. Well, that's an awesome option for patients. And you mentioned other treatments for women. We've been hearing about the O shot for, gosh, a long time. Tell us a little bit about the O shot and who's a candidate for it and how does it work?
So, the Oh My shot.
Or Oh My Shot.
That's
Sorry.
okay. I know there's so many different little names, but we draw your blood and we spin it in a centrifuge. We take out your platelet-rich fibrin and we inject it in 2 places. And we numb, by the way, so you don't really feel it. You maybe will feel a little pressure. One goes right next to the clitoris. One goes right near the G spot. And this will help increase stimulation. It will help increase lubrication. It will decrease urinary incontinence. So if you sneeze and you leak a little bit, let's say you've had kids, if you haven't had kids, it can actually help strengthen your pelvic floor and keep you from leaking. So you can maybe jump on a trampoline again, you can go running again, and
Ride a bike?
yeah, ride a bike. And then really importantly, people say it either will help them orgasm, and when they do orgasm, they're stronger and they're longer than they've ever been. So it's pretty interesting.
Now, you and I have talked about this in the past, platelet-rich fibrin, PRF, as the way to do the Oh My Shot. Patients can also receive hyaluronic acid fillers to inject inside the vaginal cavity in the area of the G-spot to also help with sexual satisfaction and stimulation.
Yeah.
And how do those compare to each other?
I will say I like to do the PRF as the first line of treatment, just because it is a little bit safer. And that if we can use your own body to help heal something or stimulate, then I think that's the best route. I feel like the filler for me is a very specific person, like someone who says they feel like they're going to orgasm, but they just don't get to that point. And usually it's because it's not being stimulated actually. So sometimes we can go in there and push the G-spot forward into the vagina so that that friction actually gets to it, and then you can achieve orgasm.
Wow. So patients have different options.
Yeah.
When they come to you for these treatments, is there a period where you say probably best to abstain from sex before sort of
Absolutely.
test driving the equipment?
Yes. So for the filler, no sex for 2 weeks. That's a very strict rule, because if you do, and you're going to be a little swollen there, so it's going to actually poke out even more. And you don't want that friction to rub down the filler. You want it to heal the way that it was put in there, and that way it does kind of sit forward into the vaginal canal a little bit more. So you don't want it rubbed down. But for the PRF, the Oh My Shot, you can have sex, and it's actually encouraged to either self-pleasure or stimulate that night. So, because it actually increases blood flow to the area, which then strengthens the effects of the PRF.
Wow.
Yeah.
And technology is always evolving. I know that there's been a technology using radio frequency to sort of heat up the tissues, a woman's anatomy, to help strengthen and build collagen. One that I can recall that's been around for a while called Thermiva.
Yeah.
Tell them a little bit about that.
Thermiva is a good choice as well. It is radio frequency, and like you said, it heats up the tissue to a therapeutic level, and that stimulates collagen within the vaginal canal. We can also do it in the labia majora, so it does have some effects there too. It can help kind of tighten everything. It can also help with urinary incontinence and lubrication. It's a little bit more invasive, if you will, with the Thermiva, so sometimes I still have PRF become the first line of defense for that. But there are some patients that do their own research, and they come in, I tell them about both, and they're just, they'll make up their mind for themselves. Sometimes with both of them, we're both increasing collagen production, and if they're really leaning one way or another, I'll ultimately go with their.
And these treatments that are done to build collagen, as you have said, is a way to achieve the results that you're looking for. Are they one and done, or a series of treatments typically?
With any collagen stimulation treatment, we usually do a series. because we lose collagen every year. So we want to help kind of build and build. Just because you do these treatments doesn't mean that you stop aging. So you want to kind of maintain this. Usually treatments of 3 is best for Thermiva, the Oh My shot. Usually the filler is like once a year, so that's a little different. But you know, doing a series is always best. And then if you get to your therapeutic, you know, if we've reached clinical endpoints and the patient is happy, then maybe doing it once a year after that for maintenance.
You have lots of patients coming back to see you
Oh yeah.
and being very satisfied with the services that you've offered and coming back for maintenance. And the other thing that I remember talking to you about was that the ladies often bring the fellas in
Yeah, they bring their
for their
husbands
own
in.
sets of treatments.
They sure do.
Tell us about the things that you're offering the gents that can help with their sexual health.
They can get the platelet-rich fibrin injections into the penis. And so we know that that has a lot of benefits like collagen stimulation. It can help with premature ejaculation. And if your partner has a hard time keeping an erection, it can help with that too. So that's a good one. They like it. It's hard to get them in, but once they come, they're
sold.
They're sold, yeah. Yeah, they like it.
And you know, one of the other things that I think you guys may want to know, and the guys out there, is that you offer services where you can enhance the size
Yep.
of the gentlemen that come to see you for these treatments, using hyaluronic acid filler to plump up the penis.
Yeah.
How does that work? And typically, how many syringes of filler do you recommend for patients? And how do you go about counseling them when they can return to having sex with their partner? And how often do they come back for sort of a refill or maintaining their improvement?
Well, the hyaluronic acid injections for the males, first of all, I would like to say that that's not painful either. We inject with lidocaine and they don't feel anything, maybe a little bit of pressure, but they're always a little scared about the pain. So they don't really feel anything. But it's important to know that it doesn't increase the length of the penis, but it does increase the girth. So you can typically, with treatments, get about 1 to 2 inches more, but it does take a lot of filler. So that's something to keep in mind. Typically, we sometimes start with 8 syringes, but it can go up to 16. So, and then very important, no sex for 3 weeks.
Okay.
So, and that also involves no self-stimulation, just because you don't want to move the product around. You don't want to lose the product or make your body get rid of it faster. So you just have to leave it be for, 3 weeks.
Wow.
To be safe.
I mean, these are all awesome services that you offer in the spa.
Thank you.
And most of these can be done very simply with local anesthetic.
Yeah.
They don't have to go to sleep. The recovery is not too bad. What's a typical recovery for both men and for women for these treatments?
2 weeks is our kind of golden rule for everything. That's usually when everyone's going to be completely healed, all the swelling's gone. So golden rule is 2 weeks. For the males, I would say 3 weeks. So.
And that applies especially to abstinence.
Yes.
Until things can heal up.
Yep. If you invest that much money in yourself, you don't want to ruin it.
No.
And then and of course we always have our surgical treatments, like you said. Like you can do fat grafting.
Right. There's a procedure called labiaplasty where I can remove the excess tissues of the labia minora, not the majora. Sometimes with aging and with having multiple vaginal births, a woman's anatomy can not look its best. And, with a procedure like a labiaplasty, I can tidy it up so it looks better and feels better. It doesn't get in the way when they are having sex with their partner. So, and that's often another procedure that can be combined with the other services that I do, both fat grafting of the labia or in combination with body or breast work that I do. So how can these guys find you?
You can find me on Instagram. It's at Nurse Summer, one word. And then there is my bio. You can click the link in the bio and you can look at my background and see what days I'm available to be seen.
She's awesome. You guys should call and get in to see her. And She has awesome service. She's a very caring provider here at
Thank
ACPS.
you. So are you.
Thank you. And if you guys want to see me, you can just call the main number, which is 713-799-9999, and make an appointment to see me for any procedure that you'd like to discuss these days. You know, in 2025, I've talked about, you know, the menopause makeovers, which are becoming big these days. When women go through menopause at a certain time in their life and their hormones levels drop, it can mean significant changes for their bodies and for their health. And many things can be done to reverse those changes that happen with menopause, at least the physical changes that happen. So you can come and see me and we can chat about that. But until then, good to see you guys, and hope to see you again soon. Bye-bye.
Thank you.